This is IndraCidambi, your psychiatrist from the United States of America. Namaste. I am today going to talk about the psychology of prostitution. It's one of the questions from the viewers, and we are going to dive right into this. We are not here to judge anyone else's choices or debate the legality of anything. We are just going to understand the psychology of prostitution. So let's unpack it all, right? The phrases like lack of nurturing, self-abasement really are loaded terms. It paints the picture of deep-rooted vulnerability. So you know what is fascinating about this? How much it aligns with the attachment theory. Figure this like this. Those early years, this is like the foundation of a house, and if it is shaky, a child is not getting a consistent love or care, the whole structure is vulnerable, and this impacts everything: their self-worth, the ability to form a healthy relationship, and they become more exploitable in the later life, and they are much more vulnerable to exploitation. So when the base is shaky, it gets more vulnerable. So prostitution is sexual violence against women. Incest is to the family, and prostitution is to the community. It's a strong, extreme comparison, but it really highlights the power dynamics inherent in this prostitution. Imagine a young woman just struggling to make ends meet, maybe fleeing a difficult path. She entered this world, she's looking for financial stability, but often she finds herself at the mercy of her clients who hold all the cards. They are calling the shots. They dictate the terms, often without a thought about her well-being. This is a clear power imbalance. It's pretty much unavoidable. It's just not at the societal level. At the psychological level, there can be severe PTSD, substance abuse, anxiety, depression. All these issues all connect to the reality of prostitution. How does it do? Trauma is the key factor. Well, imagine the constant fear of a client becoming violent, the constant threats, coupled with the societal shame that's often attached to this work. It's like living in a war zone inside your head. It's constant exposure of a stress, and the trauma leads to PTSD, similar to the veterans. So there's unsimilar similarities, it's heartbreaking. The research also highlights how social stigma and lack of support creates this horrible cycle. It's a vicious cycle. Once you're in, it's so much harder to get out. You feel like you're trapped. You're trapped. In a way, you're trapped. The stigma prevents them from seeking help. They are afraid of judgment. They are afraid of rejection. And so this is the trap in the cycle of exploitation and trauma. The whole issue of consent is a big thing. That is a complicated topic. Think about the financial desperation, or even the societal glamorization of the whole thing. How this muddies the water, it skews things. And now you add the influence of a pimp, it's almost impossible to untangle it. It's total control and power. So now we are talking about poverty, the addiction, the manipulation of the pimp. Can you even really call this the choice voluntary? So it questions the whole idea of the free will. So the external pressures are so strong that even if it is a choice, it's a question. So we need to look beyond to get an understanding of what is the psychology behind this. Early trauma, societal pressure, economical stress, the vulnerability. So the complexity of this web is so much more complex. It's more than these choices. It's a web of interconnected factors. So if you really want to address this issue, we have to look beyond just the surface level. We need to create a society that provides better resources, better support to these women. And for those who are vulnerable, we need to be more non-judgmental and understanding. So how do we even begin to rebuild when the foundation is cracked? This is the question that I want you guys to think about. That's where I'm going to leave you with. And I will come back with the next topic. Up until then, have a good one. Bye-bye.